Hello, everyone. Once again, you are welcome to today's show. My name is Decency NCLEX, the vendor of good news, and today I have an interesting personality in the show. Someone that I have here today, I've not brought her on this show before, but there's something amazing that she's working on. She's already doing it, and it's benefiting my population. You know, my population is nurses. And anything that will benefit you guys, I will bring it to you. So today, I'm going to be bringing you quality stuff. She's working on something and she's doing something amazing for nurses. Majority of you know that when you come to the United States, you face a lot of challenges. People are unable to, I will call it failure to thrive in the United States, failure to thrive, because a lot of people come in and they are unable to move ahead with their nursing career. If they were operating room nurses, they step down to becoming maybe nursing home nurse, because they just want to downsize or downgrade to a lower level of acuity where they would not be, so much under pressure. But there is something in the works, there's something already prepared that can help you to adapt very, very well to your nursing specialty without having to change your specialty, without having to, have any challenge that will cause you to lose your job or get fired at your job. A lot of people get fired at their job within 5 months of being in the United States. 50% of the United States nurses get fired. We hear these stories, we know how it goes, but there is a remedy, there is a way out. And if you listen to the end of this meeting, you will be getting those benefits. Okay. I have someone else from Liberia. Alabi, you're welcome. And I have someone from all the way from Ondo State, Nigeria. I've got a lot of people here on the show from Cameroon, from Saudi Arabia, from Nigeria, from Ghana, everyone that is here from different countries in different continents. I am welcoming you guys to today's meeting. So today we're going to be discussing with someone very special. Her name is Nancy. Nancy is a registered nurse in Nigeria and also a registered nurse in US. She's got her master's in nursing. She got other educational qualification, which I'm not going to go into because that would take a whole lot of our time. But today, I want her to be able to kind of give us a little perspective of who she was before she came into the United States. Because I want you to also relate to people's background. Because if you don't know that they were nurses just like you are right now, you will not be able to dream like them. So I want you to dream and dream even bigger than the dreams that we've had. So because of the time that we are in, the retrogression, the ban, you guys just stay and bank on those ideas. Start hashing on those ideas. Get them down, write them down, so that when you get into the United States, you don't have to plan again. You already made your plan. You just start running. All right. So Nancy, if you can unmute, kindly let us know just a little background about your nursing career from your home country and then also your nursing career in the US.
All right. Hi, everyone. Just wave a hand if you can hear me. You can use the comment section. Just wave if you can hear. Okay, good, good. All right. I'm so excited to be here, Boss D. I want to say thank you for inviting me to this special platform. I honestly love to talk to nurses. I enjoy every opportunity to talk to nurses, especially from my experience. Okay. So like Boss D said, I've been a nurse in Nigeria for over 12 years before I moved to the United States. And I am exactly 4 years now in the United States. So while I was in Nigeria, I worked with, some good private firms or hospitals there in Victoria Island. And then I worked in Federal Medical Center, Abeokuta, and then I was in Luth before I came to the United States. And I'll tell you, it's not been an easy journey, but it's interesting. And every day we learn, and I'm so honored that I've built myself in such a way that I'm available to teach nurses from my own experience. Because when we talk about adaptation in nursing, adaptation in US, transitioning as a Nigerian based nurse to a US based nurse, it's a roller coaster. And trust me when I say I've had that first hand experience, and it's a pleasure to have an opportunity to teach nurses not to make the same mistakes that we made, to become better nurses, to come to the United States better prepared. So that's my little journey, right? So I don't know, is that all we want to know?
Yeah, yeah, thank you so, so much.
Yeah.
All right, so now, without wasting much of our time, we're going to have her go into the discussion of what she's actually doing to help nurses to start safely in the United States. I think she started a company here in the United States and it's SafeStart. And what she does is she helps registered nurses who come to the United States, with some information that they need on the clinical side on how to be successful, how not to lose their job, how not to lose their license, because your license is all you've got. You don't want to lose that license. Once you lose your license, oh Lord, is back to square one. You would really not want to be in that situation. I've talked to a lot of people who have been in the situation of losing their license. Some actually eventually lost it and they have to start planning of relocating to Canada or going to another country. That's not what you want. I want you to have your license, enjoy your license, and make good use of your license when you come to the United States. So she's going to be talking to us about this very program that she's doing and what the program is really all about. So I want you to pick your pen, pick your jotter, just sit back, relax, keep your questions till the end of the meeting. At the end of this meeting, I will give you the opportunity to ask your question. All right? Remember, I told you you'll be getting quality. You see the quality of presentation we are getting given to you free of charge. No one is paying for this. Can you imagine? Oh my God. A lot of people have said, oh, you don't know what I said, please. I didn't get this, but I'm giving it to people free of charge. All right. So I want you to pass it down. When you come to the United States, if somebody calls you on the phone, please make out time to guide them. No matter what you have gained from the meetings that you have had here, don't monetize it. Just make out time to guide people coming behind you. You will get the reward in future. It's called paying it forward. So pay whatever you're getting from this meeting forward. At the end of the day, you will have a good reward for your labor. All right. I want to let Nancy. Nancy also she was our virtual class coordinator in the Decency NCLEX Academy. So you can know where the quality is coming from. All right. So Nurse Nancy, go ahead with the presentation. I've asked you to unmute. Can you unmute? Just try to, unmute from the. Yeah, yes, good.
Okay, can you all hear me now?
Yes, but go back to your slide, your presentation.
Is it better? Can you hear me?
Yes, you can share your presentation again. Good.
Oh, okay. Let me stop and then start again.
Okay.
Which one? Which curtain? Is it washing clothes? What did Daddy ask him to do?
Sorry, I think I muted you again. So you can unmute again and start presenting.
Okay. Yeah, so hello everyone. Just say hi if you can hear me so I know I'm not talking to myself.
We can hear you. Go ahead.
Hi.
Okay, perfect. Okay, so hi everyone. Welcome again. And on behalf of SafeStart, my name is Nancy Eremolor. I'm here to talk about transitioning successfully into the US healthcare system. And honestly, I would say I speak from a place of experience. And I would love you to just sit back. We don't have everything on this slide, right? There are just certain experiences that cannot be written in, black and white, cannot be written in pen and paper. But then again, there are experiences that can be passed from one person to another. And that is why Safe Start is one project that is dear to my heart, right? Because it actually boils down from, it came from a place of solving a problem, solving a serious problem. Now, it's just so you know, I'm not just a bedside nurse here, I'm also an educator here. So I also see students, internationally educated students also, who came to the United States and are interested in studying nursing. And I've seen firsthand the challenges that we go through. I've seen things that put nurses into trouble, right? I've seen nurses who face litigations. And I want to tell you categorically now that while I was doing this project, I had to do some research. And I noticed that a lot of things that make people lose their licenses or get into trouble here in the United States has nothing, or I would say the percentage is quite very few in terms of your nursing procedures getting you into trouble. What I mean is this: as a nurse, you already have your skills. So there is hardly a nurse here who does not know how to give medication, who does not know how to put a Foley, who does not know how to do blood administration, right? So these nursing skills, a lot of nurses know it already. Now, most litigations here, especially in the United States, do not come from your inability to do those procedures, no, but your inability to possess some skills that nobody teaches you in the classroom. People would not teach you in black and white clinical judgment. People would not teach you quick intervention. People would not teach you things that should be escalated. It may be thoughts, but these are things that are facility, I would say facility specific, okay? And these things get people into trouble more than the nursing procedures or nursing skills itself. And so that's the idea behind transitioning successfully into the healthcare system, US healthcare system. Let me tell you a story. So while I left Nigeria to the United States, that was exactly my second week. Yeah, we had come to Texas, and then we were moved to another state where my agency got a hospital for us, a group of us, and we were a lot. And then I think we were up to like 10 nurses. Now, just FYI, this state is a state that doesn't have a lot of diversity. So we coming there in numbers was kind of strange to them, right? They haven't seen, people like us, internationally educated nurses, coming in their numbers. And then when they read our profile, this one has 10 years experience, 12 years experience, 13 years experience, and they're like, where are these people coming from? So long story short, I was on duty that day. And so after doing my, it was shift change, I got a report. I went into my patient room and saw that the patient was laying, he's an old man, he was laying by his side and drooling. So I quickly called, I saw the tech. So the tech, what the people we call techs are the PCTs. They are also called CNAs. In your preparation for NCLEX, you may have seen them as UAP. But whatever they are called, each hospital have their own names for them. Some call them CNAs, some call them PCTs, whatever, but they are just nurse assistants, just so that you understand who I'm talking about. And so I just reached out to her. Now, as a nurse with over 12 years experience coming to the United States, all with my shoulder pad high, willing to explore, tell them what I'm made of and all of that. Well, not telling them, you know what I mean? Like, how hardworking we can be. And then I got there, I told her, please come and help me. Let me lift this patient up. So I was waiting in the room. I had waited for like 2 seconds. I didn't see her. I would say 2 minutes, maybe not 2 seconds. I didn't see her. So I quickly adjusted him a little bit. And he's big, so it was not a case that I could do it by myself. So I quickly peeped out of the room, and I was like, I will, for the sake of this lecture or presentation, I will use her name, Beautiful. So I was like, hi, Beautiful, come help me. I need to push this patient up, prop him up, so he doesn't aspirate. I said, please come quickly, so that he doesn't aspirate. And she just took her steps. I was irritated for a minute, but I'm like, I'm new here. Let me just mind the business that brought me here. And so she casually walked in and then helped me. We propped the patient, made him comfortable and all that. So I noticed she left the room. And after a while, I saw that some nurses were entering into the break room. I'm like, what's going on there? So I just peeped a little bit and saw that she was crying. Right. What happened? Why is this lady crying? Well, I didn't, I was not bothered. I'm like, let me go and do the job that I came to do for 12 hours. So, the night went. After a while, people were consoling her, like people who have been there before. Mind you, this lady, I'm just 2 weeks old on that floor, and this lady, the PCT or the tech, has been there for, I think that was her second year. So she's an older staff, right? And of course, she's not JJC like me. So I was wondering, long story short, the shift continued, and we got done that day. I just noticed she had a bit of will I call it resentment or withdrawal each time I asked her to do something. And I was like, well, but I tried to, make jokes, and she laughed at some point. I thought we were good, because I needed her to be happy so that I could successfully get done with that shift. And so in the morning, I was surprised when I got a message from my manager that a staff had sent an email. Now, mind you, we had two managers. The first one came and they were like, I should wait for them, that there is an important thing they needed to see me about. I was worried. I'm like, hey, see me that just came. What's going on? And I waited for her. She came in, and then she was like, Nancy, I've been getting reports I got reports from some staff that you're making them uncomfortable. I'm like, from where to where? From how? What happened? Like, what really happened? They said that somebody was crying because of the way I addressed her. I'm like, okay, who? They said they were not going to mention the person's name, but they would like to meet with my agency so that they would discuss whatever they talked about. Me being new now, hey, my heart was in my mouth. I'm like, what's going on? Like, from where to where? What actually happened? So while we were in that meeting, apparently the second manager entered. She had also received the message. So this PCT had emailed and copied, all the managers. And so she came in. Good enough, she was new somewhat. So she entered and said she wanted to hear the whole story, what happened. So she heard from me. I said, I'm not sure what happened, but this is the only incident that I can tell that happened while I was on shift. She said, okay. I think she that was when she now read out the lady's email and said, I think I know what happened. So she told the other manager that, no, this is not a case that we need to involve her agency. I don't think it's anything I think I understood what happened, blah, blah, blah. So they told me to leave. So I think 2 days later, she called me to the office and told me, Nancy, I've watched you, and I will tell you that for clinical procedures, I can teach you. I can teach you how to do blood. I can teach you how to pass a Foley. Of course, you know how to do those, right? You only have some challenges because the equipment we use is not exactly the same as what you use in your home country. I said, perfect, yes. But then again, it just took me like 2 days, and I'm a pro. Like, I can draw blood from anything. She said, yes, she knows, but that's not her problem. That the reason she's not going to escalate the issue is that she sees that there could be some sort of gap in communication. However, that she will want me, she has seen me as a kind person. And because most nurses who get jobs, like when you become a nurse, you're already an adult. So I can't teach you at this point to be kind. I can't teach you at this point to be honest. And these are the things that I see in you, right? But I can teach you if you don't know how to do blood. I can teach you nursing skills, right? But there are things that I can't teach. So I would rather retain someone who is kind. I would rather retain someone who has a good heart or good personality and teach the person how to do things, right? So, and that thing stayed with me. This is exactly 4 years, because that was in June, I can remember. And that stayed with me. I'm sure she doesn't know that that stayed with me, but it stayed with me, and it kind of shaped everything, or most things that I do now, even while working. So, to cut the long story, I would like to ask us questions. Could anyone just tell me, do you know what went wrong? Just from your own experience, before I end the story, we're going somewhere. Can someone just from your own experience unmute yourself, tell me what actually went wrong from this story? What would you see? Or what did you see that happened from your own experience, or from listening? Or what is your mind telling you that actually happened? Or what was the lady's offense? Listening. Can you guys hear me? Hello, are you hearing me? Hello. Oh, okay. Yeah, you can talk. You can actually unmute yourself and talk. Is anyone saying anything? Okay. So someone said in the comment section that I think your voice was high pitched and felt controlled. Okay. 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 The host mute. Okay. So you can use your chat box. You can use your chat box. Okay. Christy said I felt intimidated. No, not really. Okay. No, I'm asking, why did you think that she started crying? Why did she start crying? So if Billy Kids can they unmute, can you allow some who wants to talk to unmute themselves and talk? I guess you use Nigerian voice.
Okay, so for us to do that, we have to,
Okay.
anyone that would like to respond, you would raise your hand, use the reaction button to raise your hand, and I will let you talk. Ada or Dims, I would, okay. Ada or Dims, do you want to go? I can't see you again. If you can use the reaction button and raise your hand up, I'll give you the opportunity to talk. All right. Um,
Okay. If she felt inferiority complex, probably threatened by him. Okay. He really felt it. The comments are very funny, but yeah, I think people have, yeah, okay, exactly. You speak at a loud voice, okay. Uh, so who is speaking? Yeah, let someone speak. Who is available to speak?
I've asked Ada to
Audience.
unmute. Ada
Oh,
audience.
Ada, yes,
okay.
unmute
Yeah.
yourself. Okay,
Good
yes.
good afternoon, everyone. Nancy, good afternoon, boss. Good afternoon.
Yes,
Okay.
yes.
You know, in Nigeria, we can take
Mm-hmm.
anything. I'm in
Mm-hmm.
Canada here, even though I've not really interacted with some nurses in the hospital. But the
Mm-hmm.
issue is, let me be honest with you, most of them are intimidated because of our skills. I'm being honest. I have friends here who are
Mm.
working at nurses. They are intimidated. Do you understand? And we
Yeah,
give whenever you are working, we give it the best. We want to impress both our patients, our managers, and everything. So at that particular
exactly.
moment, intimidation won because the way you work is not the way that person, whether he or she. And secondly, they are used to soft spoken words, even when they are wrong.
Mm.
Like if it's in Nigeria, if it's me that you spoke to that way, I won't take offense. No matter how you want to see, do you understand? I won't take offense
Mm.
because we know ourselves. From our facial presentation, we know when somebody, whatever the person is talking about. So it's because it's in a different client. So I feel they are used to soft-spoken words. And secondly, the way we work, they feel intimidated that we come to take their jobs or we want to be liked. I have a friend who is facing the same thing. She's a travel nurse and she's so dedicated. So people around, they feel threatened that the manager will give up the love and everything to her. So maybe if she felt intimidated because of the way you work.
Okay. All right, Elizabeth, let's hear from you. I think that's the last person we'll take, so we don't waste so much time. We haven't even touched our slides. Elizabeth, can you unmute yourself? Let's hear from you, dear.
The host. Okay. Hello, can you hear me?
Yes, I can perfectly.
Okay. Well done. Thank you for your generosity. What I wanted to add, though the last speaker have said it, but I believe these UAP people, they sometimes they felt that you want to stress them. They are not that too strong the way we are. So that is why when you call her to come and help you, maybe she felt that she's doing extra work. That is what I wanted to add. Thank you and have a nice time.
So you all have spoken well, honestly, and I would just like to say this. So that also boils down to transitioning, right? So if not that the other manager was smart enough to know exactly what happened, or to say this is not a case we could take to the agency or call a panel for, I bet you I may have lost my job that week, second week. You know, when Boss D said a great percentage of immigrant nurses lose their job within 5 years. He's not 5 months. I mean, no, he's not joking. In this particular facility, I must tell you that we were not up to 5 that actually finished our contract there. We were like, the first batch was 12, then another 12. We were like in our 20 something or 30s, but we were just like 5, I think, in my own time that actually finished our contract in that hospital. Right. So what this is just talking about is still adaptation. These are some kind of shock that you go through when you find yourself in such environment. So in this my own scenario, it was a case of communication. So initially, I felt that she was just trying to bewitch me, which is not left out, actually. Like you all mentioned, is not actually left out. You know, that complex issues, who are these ones trying to adapt. But the other thing is this, somebody mentioned it, that maybe I use Nigerian voice. That's funny, but it's true. in the sense that one thing you must know coming to the US, no matter who you are, if you like have 25 years of experience, back home, it's normal for you to say, please come and help me do this, or go and do this, go and do this. Not that it was a harsh tone, or not that you were rude with your language. You know how something, you want to do something really quick, oh, quickly go and do that thing. You're sending the person on an errand. Here, you don't categorically say that. You would ask in form of question. Boss D can attest to that. So if you want to tell someone, I need you to check this blood sugar, you won't have to go directly to say, please go and check this blood sugar. Can you check that blood sugar? Like, you literally have to ask questions whenever you are delegating. Your delegation come in form of a question. Would you want to get this blood sugar? Would you want to? So that was, I'm not totally neglecting that there was, some complex issues and all of that, but I'm just saying that when the manager told me, Nancy, I need you to take your time, observe. What I see here may be cultural differences. I'm not exactly sure what happened, but I want you to observe and know where you can adjust. And I promise you things will be better. My dear, that was how I started, being that's why when I started being culturally competent, I would say. I started paying attention to, okay, so how do these people, they don't like confrontation. Somebody can smile with you and say, oh, no, it's no problem. And the next minute, an email has gotten to the director of nursing or whatever. If there is an issue, this is the better way to address it and all of that. I'm making this emphasis also because this has a lot to do with practicing in the US. Now, we know that we are talking about patient safety. However, you cannot take away your cultural adaptation, because a lot of people lose their licenses, are walked out of a job, not necessarily because they do not know their job, but because they were not careful enough to understand the dynamics of their environment. I would also tell you this story. This happened, let's say, like 3 months ago. He's not a nurse. He's also a tech, but he's actually an immigrant. He was walked out of the hospital. What happened? This is someone that is so generous. He's so hardworking. But on this day, you know how we are very, some people are very, very, very liberal with their speeches or jokes. They joke about everything. Unfortunately, that day, he made a joke statement with the wrong person, and the person reported to management, and she accused him of verbally harassing her. And that was how he was walked out of the job. But that's whatever happened after then, but it was really embarrassing, right? And everybody was like, what actually happened? Like, this is nothing, it's not enough to have let this man lose his job. But the truth of the matter is, he was not careful enough to understand that he's in an environment where he has to be careful of the words that he used. So this takes us back to, why is SafeStart? Why did we think of working on SafeStart? Why did we think of this project? If I sit here to tell you my story, it's not a lot though, but I'm just saying that there are just some stories that you need to really relate with, and we talk to ourselves that, no, we cannot stay and this will happen to another nurse. Like, subsequently, those who came after us in that particular clinic until I was done with my contract, trust me, they didn't have to go through all that we went through. We were like the guinea pigs. Yeah, because we had to protect them. We saw where there was danger. We kind of covered them. That's, immigrant nurse mentality, especially when you have like 25 years experience, 10 years experience on your shoulder pad. You are coming all prepared, those kind of things. We're able to kind of cushion that effect, make them tell them, come, this is not a time to to just calm down. There is time for everything. And they didn't have to make all the mistakes that we made. So quickly, I will go back to my slide. So transitioning successfully into the US healthcare system, I was able to bring in some key takeaways you should know, right? Because whether we like it or not, you are all preparing to come into the US someday. The first thing you want to do, once your agency has given you your whatever, your contract, this is the place you're going to work. You know, you have to do your license, your endorsement. On the website of that your board of nursing, you would see a lot of things, a lot of information. Please scan through it, because you have to understand your state's practice act. So even though we all work in the US, there are different states have different expectations. Definitely, there are things that are general for all nurses, but you have to know what is accepted in certain states. Scan through it. I'm not saying you have to read everything word for word, but scan through it and see what interesting information you can find. Trust me, that few minutes you spend to read it could make a lot of difference. Now, never perform a task beyond your competency. And that's why I keep emphasizing, a lot of us who are immigrant nurses come with a lot of experience, trust me. And I'm sure that if given the opportunity, you can even do more than what you are asked to do. I know people who have been head of hospitals back home and come in and they want to show how good they are. My dear, this is a place where when they mean you with litigation, you are going nowhere. Like if they have a place to nail you, they will nail you and nail you seriously. I'm not trying to scare anyone. I'm just letting you know that when you can avoid trouble, please avoid it at all costs. You know, all those shoulder pads on your shoulder, just keep it one side first. If something is not written as part of your job description, please do not do it. Even if you have to, make sure that maybe all the leaders are aware, whatever, something is signed or there is something that is stated that allows you to do that because you have been trained for it or something. Otherwise, do not. A very good example I will give is people who work in mother and baby. We know that there are a lot of women who are very good at piercing ear, girl child ears. You know, some people are good with what's this thing, male, what is it called again? Circumcision, yeah, male circumcision. And you know, let me do it. Please and please keep your skills in your pockets until it is needed. If they want you to do it or they feel that they have trained you for it or whatever, they will tell you. Do not perform tasks beyond what you are asked to do. Not just your competency, but beyond your job description. Stick to your job description so that you don't get an unnecessary litigation. Another important thing is prioritize your patient safety. You know, I was talking earlier on that a lot of things that give people problems here, litigation, is not necessarily your nursing skills. It's not necessarily the skills on nursing procedures. No, it's a lot of other things surrounding patient safety, maybe linked to the procedure, but not the procedure itself. Somebody cannot, you are not going to lose your license because you did not insert you inserted a Foley once. When I mean Foley, I mean urinary catheter. We call it Foley here. So maybe you inserted Foley once, you didn't get it right, and then the nursing board will take your license from you. No. You're not going to lose your license when you try to put an IV. You try once and you try twice, you didn't get it. They will say, no, your license is taken from you. No, you're not going to lose your license like that, because guess what? If you can't do it, you reach out for help. Someone else who is better in that skill will come and do it for you. But there are certain things that can affect the patient's safety. That is where you have to prioritize. That's what you have to focus on. And that's why when you get to your hospital, aside knowing your job description, aside getting used to your act, that's the Nurses Practice Act of that state, one thing you should also get to know is your safety protocols. So every hospital have their protocol. You have to get used to it, because you see this license that you cross 7 rivers and 7 seas to go and get, you don't want to lose it in one day. And once you lose it, it's like your existence here is almost gone. An example I will give is blood administration. So I had this, well, not he's a nurse, but he was precepting, and I was doing my rounds, and I saw that he's on his pump, his IV pump, he was administering blood at 70 mils per hour within the first 15 minutes. And I went, I said, why is your pump, why are you administering blood at this? He said, he told me that he has been a nurse for, I can't remember how many years he told me, but he just snapped and said he's been a nurse for how many years, blah, 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 blah. So I said, okay. When he was done, I called him out. I said, I'm not doubting the fact that you've been a nurse for kingdom years. That's not the point here, right? But if anything happens to this patient, you're going to be liable. So I brought out the hospital protocol and I handed it over to him, blood administration. Trust me, just like I said, being a nurse, he could administer blood perfectly well. He did, he put all the lines, everything was going through. He did all he needed to do, his normal saline, his blood, everything was going fine. But guess what? Because here, a lot of things, what you impute in your IV pump gets transferred automatically into the patient's chart. So anybody looking at the patient's chart will be able to read that within the first 15 minutes of this patient administering getting blood, it was given at 70 mils per hour. And the protocol says start at 50 mils. That is a safety concern. So the protocol, they in that hospital have a reason why they want you to administer blood within the first 15 minutes at 50 mils per hour. I'm also coming from a place where the protocol there says 60 mils per hour. Some say 70 mils per hour within the first 15 minutes. So irrespective of how long you've been doing it, if anything happens or anything goes wrong or there is an audit by any of the managers, they just decided to do audit, because blood administration is something they do audit for. Also, is one of those audits that they do to kind of, I would say, patient safety concerns that they do audits on. And they identified that this patient had blood and something else happened later, and patient relation or family claims that is because this blood was given at so time. And mind you, patients are able to see their reports. So a lot of patients are able to see what you have charted, depending on your hospital. Some hospitals allow patients to see even what you documented. So if such claim comes and they bring your hospital protocol out and it's away, you are liable. Such thing can take your license away from you. Even if it doesn't take your license away from you, such thing can also make the hospital to pay a lot of money from, litigations from family members and all of that. They can claim damages on you or the hospital. And you don't want to get your hospital into such trouble. So follow safety protocols, pay attention to what happens in your hospital. I know you know what happens, but please, my point is focus on what your hospital wants you to do. Then use 2 patient identifiers. Who can tell me what are the 2 patient identifiers? Let me see if someone knows. Can anybody tell me? Who knows your 2 patient identifiers? Tell me, quick. And oh yeah, your name and date of birth. Perfect. So you want to also make sure you prioritize that. That is a safety concern. You also want to pay attention to falls, infection, medication errors. These are the things that you want to pay attention to. Okay. Then communicate effectively. learn to communicate effectively. And that was why I gave you that first story I gave you earlier. You have to use your S bar. I'm sure you guys know S bar. If you don't know, you have to go and Google it, because we are running out of time anyways. But use your S bar for both provider communication and even to your fellow nurses. Okay, you want to communicate effectively. And one thing again I noticed about immigrant nurses is I will call it being defensive, right? Whenever you communicate, be as clear as possible. And then if someone, the person at the receiving end, asks questions, don't feel offended. Give more clarity, if you understand what I mean. Sometimes we are quick to kind of resent that kind feedback. Sometimes they want to read back to you, are you saying this, so that they can confirm. Some of us are pretty resentful about it and become defensive. Please be effective with your communication. Be as clear as possible. Speak up when patient safety is at risk. Don't feel like you have everything under control. At the slightest thing, when you feel that something is not going well, please speak up. Speak up and document. Now, master documentation. This is very important. Of course, even back home, chat accurately and promptly. However, one thing I would want to tell us, especially internationally educated nurses, please, even while documenting and you want to document everything, make sure that your documentation favors you. I don't know how to explain it. If somebody can find the right word for me. Like, while you're documenting and you're trying to document verbatim what happened, also make sure that you are documenting it in a way that you are safe. Do you know that you can actually document the writing and exactly what happened and still put yourself in trouble? It's possible. So you want to document and read it again to yourself to be sure that while documenting, you are safe. Your documentation puts you at a safe spot. Okay. Then make sure you document your assessment, your interventions, your outcomes. These are things that we'll talk about later on. And then clinical judgment. So when we're talking about those skills that you may not be taught in the classroom, we talk about clinical judgment, time management. These things are very important. So you need to learn to think critically, anticipate complications, right? So when you are when you are in the during your shift, I would say during your shift, your brain, your mind, and everything, at least within that first 6 months or 1 year, until you finally understand the system, please keep your phone one side. Just keep your phone. I'm saying it because you see, this phone is a distraction that a lot of us don't know that gets us into trouble. Sometimes a lot of us have earphones. Sometimes we are just on the phone, doing one thing or the other. At that point where you are not used to that system or the facility, is a very wrong time to have yourself distracted by anything. Let your eyes, your ears, everything be at alert, because you don't even trust the next person. Like, you could get into trouble. Somebody can make an error and put it on you just because you're not paying attention. So you don't even want that on you. You prioritize your tasks, you cluster care. Cluster your care, as when possible. Other things to keep in mind is to delegate appropriate tasks, right? Like, we're talking about delegating tasks to the UAP and all of that. However, I want to let you know that whatever task that you delegate, accountability remains with the nurse. So if I have a patient that has a very high blood pressure, and I gave blood pressure pill. Okay, no, I didn't give blood pressure pill. Or I sent the UAP to assess that vital signs for me. And the patient takes the UAP takes the vital signs and does not tell me that patient's blood pressure is up to 200. I mean, systolic blood pressure, maybe 200 over 110. And I get busy doing stuff and forget, and the patient does not get blood pressure medication. If that flags off and your manager calls you or that patient gets into crisis, you, the nurse, will be the one in trouble. And that's why they said when you delegate a task, make sure that you follow up. It is your responsibility to ask, oh, so and so PCT XYZ, did you take that blood pressure? What was it? Sometimes you go to the chart, you check what was the result. That way you know how to intervene, because some of them, I don't know if it's on purpose. I'm telling you that I've had to see a blood pressure of 200, 110, and I was busy and nobody notified me that this patient had a blood pressure as terrible as this. It was just while thinking of going through the charts, I saw that, this patient has, this type of very high blood pressure and needed quick intervention. So my point is, when you delegate tasks, make sure that you follow up, because accountability remains with you, the nurse. Then practice patient-centered care, respect patient autonomy. So here in the US, you do not force a patient. If a patient that is alert and oriented times 3 to 4 says, I do not want this medication, please don't force it on that person. I know from wherever we come from, sometimes when we see that the benefit outweighs the risk, we want to, impose that patient to take that medication. Here, patient has full autonomy. The patient is involved in decision making. If patient says no, the no is no. The best you can do is to educate the patient. This is the reason why this medication was prescribed. This is the reason why this intervention was prescribed. You will benefit from it because of this, and this. However, if patient insists that they do not want it, you just chat refused. You chat it, make sure you document that you offered and it was refused. Another thing you do, like I said, follow your policies and procedures, very important. Report concerns and errors appropriately. Maintain professional boundaries. Please maintain professional boundaries, like I was saying. So here, some people do not like to be very close to people. I don't know if you have noticed it. When I came earlier, it was a culture shock for me. Sometimes you want people to know that you are comfortable around them by being close, but you see them moving around. Sometimes you feel, what is this person? Doesn't this person want to? It's just a culture thing. There is a distance that is too close for comfort here. So you have to get used to knowing, understanding such will I say cultural differences. There are just some times that you don't have to be too close. Secondly, understand that a professional environment is a professional environment. Mind what you say, mind what you discuss. You cannot go to a patient's room and maybe you see that one political discussion is going on the television, and then you open your mouth, and start discussing politics, whether in favor or not in favor of whatever the patient thinks. Patient can use it against you. Even when you are religious, you can pray for your patient, you can do whatever you want to do, but please do not go and offer unsolicited prayers. Don't offer unsolicited advice. If it's not solicited, you don't have to start telling them all your stories and giving examples and telling them this is what they should do. If it's unsolicited, you're already crossing that line. You are crossing that boundary, that professional boundary. You're already crossing it. And trust me, it never ends well. It never, ever ends well. Also learn from experienced nurses. So when I say experienced nurses here, please, like I said, a lot of us who are internationally educated come with a lot of experience. However, please lower your shoulder pad. The reason is that, like I said, every hospital is different. Now, you could come to the hospital, for instance, you are asked to work in a hospital and you are like 20 years experience. The person precepting you is almost the age of your daughter. and maybe just finished nursing school last year, and maybe it's already 1 year or 2 years in that hospital, and the person was asked to precept you, please be humble and learn. Be teachable. Don't be defensive. Do you know why? That person that you think is a new nurse, as far as that hospital is concerned, the person is much more experienced than yourself. So you don't want to, there is no issue of 20 years versus 1 year in nursing. Keep that aside. Learn what you have to learn, because as far as that hospital or that facility is concerned, the person is more experienced than you at that time, right? So make sure you learn, ask questions, and get feedback regularly. Stay current, don't stop reading. Stay current, know what's happening in your hospital. Know what is happening in your hospital. Continue to develop your skills, right? Because honestly, the worst thing that can happen to you, especially in this place where we call land of opportunities, is to be redundant. As soon as you get settled, as soon as you get a bit of relief, keep developing yourself. It will pay you in the long run. Respect diverse cultures, like we always say. Please and please be very there's this word I'm looking for. Be emotionally intelligent, I would say, and be observant. Pay attention to your environment. Don't be that kind of person that just come to an environment and just want to take over. It's good, it's a good vibe, but understand if your environment actually requires it, right? Because even as we go from facility to facility, we also notice that there are different vibes. You go to this facility and they are very okay with you vibing with them. You go to another facility and everybody just wants to be on their own lane. In fact, if you say good morning, they won't even answer you good morning. They are not obliged to. Don't pick offense. Yeah, I've worked in a place where you will say good morning and they won't answer you. Like, it's weird for people to come and say, hey, how are you? Good morning. They don't greet. They literally just come, resume, and do their thing. It was a shock for me initially, but later I vibed. I just moved with the flow. So understand your environment is basically what I'm trying to say. Provide inclusive, unbiased care. Here we have a lot of course, people are free. People have different rights. People have taken certain decisions which they are responsible for. So even if you are not comfortable with that decision that they have made as a person, please and please mind your business. You are not obliged. Like, I would say it again. I'm saying it because I have seen a lot of people that have gotten into trouble because of it. If you're not comfortable, provide unbiased care and move on. It is not in your place to start to give moral advice. It's not in your place to start to give unsolicited whatever, or telling them how they will make heaven or not make heaven because of the decisions they have made for themselves. Okay, so let's put that in mind. Some people are too carried away. I really don't know why they get carried away so much that they forget that people have different cultures. Like, back home, people can talk to you and advise you even without you soliciting for such advice. But here, people take it really, really offensive. Excuse me, really offensive, and you can get sued for that. Another thing is manage stress effectively. So take care of yourself. I really want to emphasize on this. A lot of immigrant nurses also get into trouble because they fail to take care of themselves. I'm not going to lie to you. Working here is stressful. It is very, very stressful. And when you work in a stressful environment, you don't take care of yourself, and you go back again to work, your mind cannot be sane to take all that the shift is going to offer you. Like, you will find yourself being forgetful. You are not rested. You are panicking. I don't know. Everything messes up if you're not careful. It takes a lot of energy to still keep yourself sane. So I'm saying this because a lot of us come and they start picking shift back to back. I'm not saying it because I'm a saint, or even me that is saying it, I'm not innocent. Sometimes things just, you just have some targets, you just have what you think you should be earning, and then you want to work yourself out. Please and please, especially when you find yourself not yet adjusted to the system. When you work, take adequate rest so that you can go back sane to accommodate all the all the wahala in your units. You understand? And you don't, and yet you are able to document without getting into trouble. A lot of us want to, because we start making dollars, we want to start making dollars, we want to start sending home, we want to do so many things at the same time, and you see us working ourselves out. And the time you work yourself out, you don't take enough rest, you get into trouble, because you're going to make a mistake that will definitely, you know, put you in trouble, basically. That will definitely, someone will have to audit your chart and say, what happened? And you will not be asking yourself, am I the one that actually documented this thing? And you must have documented without knowing. That is stress. So prioritize self-care, work-life balance. It's not easy, but it's possible. So those are the things that you can do to help you transition well. So all these things I've run through is just tidbits, right? But I'm telling you that here at SafeStart, I told you it's one project that is dear to my heart. Um, we have built like structured lessons to walk you through how you would, successfully transition into the US healthcare system. So we titled it From Knowledge to Confident Practice. Of course, like I told you earlier, as nurses, I'm especially internationally trained. I am of no doubt that you know your onions. I'm of no doubt that some of you have been working in very big places for kingdom years. So you have that experience, right? But then again, there are certain things that you need to learn so that you don't get yourself into trouble. There are things that you would see in your unit when they talk about critical lab results, when to escalate issues, codes, your protocols, things like that, that you need to know. Like when you know those things and you get into your unit, when you are talking, the anxiety is on another. That's Your anxiety is not as terrible as somebody who does not know Jack. Like for us, we didn't know Jack. The only thing I had in my head was my experience from back home, and thinking that it was all ability to do your nursing skills. No, it is much more than that, right? So we didn't know that. We didn't know about the protocols. We didn't know about setting codes. We didn't know like who to talk to, how to escalate concerns. Escalate concerns so that you don't get into trouble, because there's a way something will happen and you are quiet about it, you even get into trouble yourself. So things like this is what we have structured, like put them into modules just to help you so that you don't make the kind of mistakes that we make. And then when you get to your unit, you are confident. Like people will be like, excuse me, did you say this person just started working like 2 weeks ago? Because we've been able to create an opportunity for you not to make the same mistakes that some of us made. If I call a lot of us to come tell us their experiences, oh my word, you will marvel at people's experience. People have gone through a lot because of things like this that they did not know how to handle. And we do not want, our nurses to make the same mistake. And that's why Boss D has said I should come and talk to this platform so that they can also benefit from it. Whenever they get to the US, they are, I'm not saying you are 100% prepared, but at least you are like 60 to 70%. And so you work with some sort of confidence, not totally ignorant of your environment, so that the people don't get you into trouble. Because trust me, not everybody is very receptive of you immediately you get in there. Once you get in there, there must be somehow there's just someone person that is just not happy that you are there for that, at least for that time, until they get to know who you are. So that's why we actually said, okay, let us bring up these courses or modules. And with time also, we also offer mentorship. right? We also offer mentorship. Sometimes things can be really difficult in your unit. You'll be wondering what's going on. Wasn't I a nurse? Why is things going this way for me? You could talk to someone. People can share if they've had similar experience and what you can do and help you seek help, right? And assist you to seek help. All right. So in just to end it all, I would just say, remember that you have to be safe first before being fast. So with all your experiences, don't focus on trying to impress people. Leave impression for now. All you can do is ask questions and don't make assumptions. Protect your patients and protect this license that you have crossed 7 rivers and 7 seas to get. Confidence comes with practice and experience. With time, trust me, you will get it. And one thing about nursing is that it's a lifelong learning thing. You can never know it all. So present yourself every day as an opportunity to learn something new, okay? Like I always say, be safe first, not fast. Don't be quick to impress anybody. Understand what you need to understand. Make sure you're comfortable, be safe. Because the truth is, when there is a safety concern, you're in trouble. When there is a late concern, like maybe if you are late but it does not affect patient safety, you can be spared, you can be forgiven. But if it's a safety concern, my dear, it's trouble for you. So I would end it here by saying, please take care of yourself. And if you have the opportunity, you can also talk to your friends about SafeStart. That's why we call this SafeStart. Starting safe from whatever you know to confident practice. So you're able to transition safely into confident practice. Thank you very much for listening, and I'll be here to answer your questions.
Wow, thank you so much, Nancy. Thank you, thank you. This is an eye-opening session, and I know that majority of you have gained a lot from this session. If you know you got value for this session, I want to see you type value on the comment section. I want you to be sincere. Type value on the comment section because I know that this has been so insightful. Even me myself, there's something I gained. I was like, I went to the comment section and I wrote, you are not coming to the United States as an evangelist, you are coming here as a registered nurse. So let's be guided so that we know our real intent. You cannot come here as a nurse and there in the unit, you turn yourself into an evangelist and start preaching to every patient, especially those of them that you see that they have crossed boundaries, like they were formerly male and they then decided to become female, and you want to convert them back to Christ all in one meeting. Yeah. I know it's good. I'm a devout Christian, but I know that when I'm at work, I'm going there as a registered nurse. And when I'm outside, if I'm in the bus or somewhere going somewhere, if I meet people and they give me the opportunity to come into their space, I can talk to them about what I believe, but not in the workplace. So, oh, we got a lot of value. We got a lot of value. Thank you so much. This was a very interesting session. And I know that one or two persons may have gained something, just like I did. So if you know you got something that you would like to share with us, either by raising your hand to use the reaction button, or you can type it in the comment section. One take home from this very insightful lesson. Just type it on the comment section. We want to share because some people might not, have missed, maybe may have missed that very important point, but you grabbed it and you want to share it today. I would like you to, on the comment section, write it down or just raise your hand with the reaction button and I will be able to give you the permission to share what you gained or what you learned from this session. Yes, I have someone, Amarachi. Amarachi, go ahead. I asked you to unmute. Go ahead and give us your benefit from what you learned from the meeting.
Okay. Good evening, Boss D.
Good evening.
And good evening, everyone. Thank you so much for this session. I didn't join from the beginning. I joined midway. But from the part where I joined, I gained so much. One key takeaway for me from this training this evening is that you do not know it all. No matter how long you have been in nursing, if you go to a new place, you're a beginner. So I am telling myself today that having been in nursing for close to 2 decades, if I get to a new facility in the US, I am a beginner. So I am going to use the experience that I have, but at the same time, I am going to downplay it just so I can understudy the system where I have come to, understand it, marry it with the little that I think I know from back home so that I can excel. Because the reason I'm there is to gain new experience, excel on it, and of course, make the best out of my license. So thank you so much. I learned a lot. I might not be able to itemize everything that I gained, but I did gain so much. Thank you.
Amazing. Thank you. Thank you. I appreciate that. Thank you, Amarachi. I have another person that wants to share today, and that is Okechukwu Daniel. Okechukwu Daniel, you can unmute and share with us what you learned from our session today.
Good evening, Boss D.
Good evening.
I'm calling from England, so it's evening for us. Sorry, guys. Good day, Nancy. Thanks for this session. It was very insightful. Lots of stuff to learn. What I would, the main key point for me was everything Nancy said is centered around patient safety. So the thing is, if we all go to work with the mindset of patient safety and positive outcome, it will go a long way in in the way we dispense our duty. So if we have that safety mentality, that whatever decision we make for this patient, is it going to keep the patient safe? Is it going to lead to a positive outcome? What that positive outcome? How does it now translate to our own image? How does it translate to my image as a nurse? So because if I give a safe and quality care and the patient has a positive outcome, it translates to me being, oh, this is a skillful nurse who knows his or her onions. So if we have that mindset of patient safety, quality improvement, continuous learning, and a positive professional image, it will take us, it will go a long way in helping us throughout our practice as nurses, basically. Yeah.
That's amazing. That's amazing. Thank you so much, Okechukwu, for sharing. I really appreciate that. And then also, we have a lot of people who have dropped what they gained from the meeting in the comment section. So I'm going to read it out. The first person is Njoku. Njoku said, I learned that I should cross-cultural diversity. And then I have BC. BC said, thanks, ma. The info is worth millions of dollars. All right. Okay, then there is more from where those info came from. So I'll be sharing that very soon. All right, so now we have Glory. Glory said patient safety and staff willingness and readiness to learn. This is top notch, 100%. And I have someone else, Elohim. Elohim said, oh, Elohim, why? He said, I learned that hospital protocols must always be followed for the procedure. Oh, I thought I saw something about fellowship. Did I see something about, please, do they have, Elohim is also asking, please, do they have hospital fellowships over there in the hospital? They have chapels, yeah, they have chapels. I thought you were trying to tell us that you want to join fellowship. You open your own fellowship in the US or something. I didn't read that correctly. Why? That's why I said Elohim. Why? All right. So I got that. That's what you learned was a very, very, very nice point. Okay. So we have Alabi. Alabi said, "Be ready to learn and don't raise your shoulders." Yes, she mentioned that a couple of times. Do not raise your shoulders too high. I must work on my tone of voice and must always delete with questions. Okay. Delegate, I think you wanted to write delegate with questions. All right. So Chinonye is also saying after your contract ends with your agency, what is next for an immigrant nurse? Come to Virginia. That's what is next. Okay, so if you give me that open check, I will answer you the way it favors me. All right, so that was a good way to bring everything to a close. I don't know if there's anyone that has any question that would like to ask our guest. We have actually spent over an hour 30 minutes for this session, and I really don't want it to go over to like 2 hours. I just want us to see if we can end it all in the next 10 minutes. So if you have any questions you want to ask, I'll be more than happy to entertain that. You can use the reaction button or you ask it on the comment section, and I will give you the opportunity to ask your question. Please, if you are not yet an NCLEX passer and you're here gaining from all the things that we're saying, you have a long way to go. And we want you to become very, very close to these discussions. These discussions are actually for people who are now ready to get into the United States, like they are one step, into the United States. So if you have not gotten your NCLEX already, we can also help you. We have different NCLEX classes. We have our virtual class, we have our WhatsApp classes, we have IELTS classes, we have CBT, we have PTE classes. So all these classes are designed for you, and we have one-on-one classes as well. So any organization that can boast of one-on-one are organizations that have so many instructors, and we do have instructors ready to assist you with your process. So if you want to have a one-on-one instructor for your NCLEX, just get in touch with us. We shared a couple of our flyers when we started, and if our specialist is here, he's going to share it again before the end of this meeting. And I'll also leave a number for you to contact. So get in touch with us. We would help you to get close to this process as much as you can be, so that these things that we're saying will make an actual meaning, an actual sense for you. And I also encourage everyone to go join us on our YouTube so that you can benefit. There's going to be a lot. I've already lined up. I've loaded my gun for the month of June. We are fully booked. All the people that are going to be talking to us, they've all accepted their invite. They are working on their presentations. So you are the one missing out if you are not joining our YouTube and if you are not part of this very program. So I want you to also click the link, join our WhatsApp group. That's where we share the links every Friday about this meeting. So join and stay there. Every Friday you will see a link to come here and learn. It is free of charge, coming from the vendor of good news. Of course, no other person than the vendor of good news. We have someone, Glory. Glory has a question. Then after Glory, I'll read out some more questions on the comment section. Glory, go ahead and unmute yourself.
Okay, hello, Boss G. Good evening
Hello.
once again. I'm really grateful for all what we've had to learn today. In fact, we just felt like we are already over there. So it was really interesting. I really felt like I saw myself in the hospital already. So I really want you to appreciate the presenter. I have this little concern. So when there is an error, or when you do when there is something the hospital has to call your agency for about you, like you do an offense or negligence, something like that, the hospital has to call your agency for, what could be the outcome, and what could be the kind of problems that may make your hospital to get to the agency and not to you directly. Yeah, I think it's understood.
Okay, let me, you can unmute and answer the question, Nancy.
So there are a lot of things. We talked about being safe, we talked about issues. So the truth is, both patient safety, cultural issues. So here they also take comfort of their staff, in quotes, comfort of their staff. Be reminded that as an agency nurse, you are more of a contingent staff, right? So just very few hospitals are actually interested in taking care of you, for lack of better words. What I mean is that your care is the responsibility of your agency, right? So when there is a problem, first of all, they will call your attention. Some will call your attention, some will not. They will just report to the agency liaison, and the agency liaison will come and have a meeting. So depending, and in that case, when it gets to that case, your opinion, I'm going to be very sincere with you, your opinion does not count 100%. A lot of times, before they get to that point, they are already deciding whether they want to keep you or not. But if at all, they still call you and have a panel, anything can happen. Like, truly, it's not in all cases that they call your agency that they actually want to terminate your job. It could be that they want to give you a warning and they want the agency to be aware, so that if that happens again, maybe the second or the third time, then you may be asked to leave, if you understand what I mean. So example of such cases is just what we are talking about: making errors, safety concerns. Maybe there was a critical lab that came and you did not document within 15 minutes, something like that. It could be that they notice that you are too loud, because here also they don't like people who are too loud. If you are too loud for comfort, they start to tag you as somebody who is making their staff uncomfortable. Something like that. They can say that you are not exhibiting professional behavior. Something like that. Yeah, it can be. I had a student who almost was expelled. He's an internationally educated student, but he came here to do, he did something else back home, came here and wanted to do nursing. 3 months to graduation. The notes he gave, the notes that he gave to the staff was not typically offensive, but the person claimed that she felt that he was looking at her in a certain manner and she was becoming uncomfortable. That guy nearly ended his nursing career. I'm telling you live. I'm not trying to scare you. It's not that bad, right? But it happens, especially for the males sometimes, especially when you want to be too close. And that's why I keep saying, understand your environment, read the room. That's the best thing you can do for yourself. Read the room. Because that thing that you take as a joke, someone else here may not take it as a joke and you won't go scot-free. So it took a lot of intervention for him to be kept back in place. But something like that. So assuming you are with an agency and you have that kind of behavior of using some languages, or they were having a conversation about cats and dogs and whatever, and you started giving your own 2 cents on how you hate this and hate that, and somebody picks an offense and feels that you are condemning them or their decision, something like that can be tagged as unprofessional behavior. Your agency might be made known. They may not immediately ask you to go. You could be given a warning, but just so that you know things around that area. So the point is, pay attention to your environment. Understand your environment first before you let loose, basically.
Amazing.
If that answers your question.
Yeah, I think you did justice to that. Thank you so much. And with this, we're going to be bringing this meeting to a close. We're already running very, very late for this. I went through the questions on the comment section and I tried to answer some, but I think I will just read out this one. Say, please, if for a patient that refuses medication, do we just document patient refused, or can we persuade, or can we ask what the problem is? Please, I need more info on this. So a patient that refused medication, go ahead.
Okay, so if a patient refuses medication, like I said, your duty is to educate the patient. Sir, we are giving you this, or ma'am, or whatever, we are giving you this medication because your blood pressure is really high and we need to bring it down. If you don't take this medication, you're at risk of having a stroke, you educate. And the person says, I don't want this medication. Please document. But the truth is that your persuasion there is not saying, please take, or forcing the person like we do, wherever we are coming from. No. Once the patient is alert and oriented, times 3 to 4, in fact, sometimes even times 2, and patients say they don't want, and you try to educate, please, you document. Okay, document and then follow your hospital procedure in returning that medication. Either you return the medication, or if it's already opened, you discard. And that brings me, well, that's another topic. It's something we'll discuss later in our class about signing medication before you give. Here, there is always back and forth with people taking medication and not taking medication. So things like that, you will come across it. You don't want to sign a medication and you have not given, and then you forget to unchat it. That can get you into trouble. So, but that's basically
So
my
if
answer to that
we,
question.
yeah, so Nancy, if we want to reach you, how do we contact
Okay.
you? Can you put your contact on the comment section? Is it possible? So in case anybody wants to reach Nancy, if you want to be part of her course, if you want to take part in the course or get more info, more details about the course, so you can reach her through the link or the phone number or an email that she'll be dropping on the comment section. And I'm going to wait for her to do that, but please get ready. We're going to say thank you in different languages like we always do. I don't want us to interrupt what she's typing. So when she's done typing, I'll let us know so that we'll give her a test. We always give our guests a test whenever they come here, and you're not going to be an exception. So we're going to give you a test today, and you have to read in different languages. So we are ready to say thank you to you in different language. So we want to see if you can pass our test. Since you have given us a lot of information today, is our way of saying thank you. And guys, when you write the thank you in your language, please state the country where it's coming from so that we are aware of what we are saying. Okay? All right. Thank you so much. So Nancy has dropped number, and then also if you want to reach out to her on WhatsApp, you can chat her on that number. I will repost the number before the end of this meeting. So Nancy, we have a lot of people saying thank you. Sorry, you said?
I say we also have a like a flyer which I'll make available to you.
Okay, yeah.
The poster, yeah.
All right, so I'll get that. All right, so now, Nancy, over to you. Start from where you dropped the number and read.
Jesus, okay. Ndewo Imela, of course. Thank you. You're welcome. Adupema, Eshejare, thank you. Shukra, Saudi Arabia, Dalo, Nagode, Dalo, Ndewo, Esheun, Adupe, Esheun Jare, Imela, thank you so much. Mia, all right. Agbao, Dalorine, Adupe, Obulu Kakabo. What language is this? What
Oh,
language is this?
it looks like somewhere within like the middle belt. I don't know, maybe.
Oh yeah.
I think she said
So, that's Calabar, yeah. Dalu so. Weko Biro, Weko Biro.
Robo.
Weko Biro. Yeah, you're a boy. Okay, those states. Isha. All right. Salamat Abikpo. What's it? Oh,
Okay,
Philippines.
I think you've done a good job. You've done a good job. We always do that at the end of our
Thank
meeting. That's
you.
it. That's our only
Yeah.
two way of saying thank you. So thank you,
Thank
Nancy,
you so
and do
much.
well to
Thank you. I'm so
send.
honored.
Yeah, do well to send
I'm
me
so
any.
honored to be here.
Awesome. Do well to send me any information you have, and I will share it with them. All right. Thank you so much, and
All
God
right.
bless. All right. Thank you,
Bye.
everyone. I would see you guys next week, Friday. We have an interesting personality. Next week, Friday is going to be fun because we're going to be talking something that we've been talking on this meeting. If people have asked me, questions about marriage, is it better to have joint account or not joint account? All those kind of marital challenges that people have when they come here. We are bringing a seasoned person to come and talk to you next week, Friday, and it's going to be centered on marriage, how to coexist with someone, the cultural differences that you're going to have to deal with when you come over to the United States, which you are not originally accustomed to in your home country. So keep your ears open. Watch out for our flyer. Next week is going to be a great time to be on this show. All right. Thank you and God bless you. I'll see you all next week. Bye, everyone.